Hey guys, long time no see. Um, yeah, I guess I got a few messages going to an update, and nothing has really been majorly happened. There haven't been any major changes, um, like transition wise. Uh, let's see here. I'm only up to zero point 0.6 or 60% of basically normal dose, so I'm not even at a full dose yet. Um, I don't really think my voice has gotten deeper. I have a few more hairs around here, but nothing to really brag about. Um, what else? What else? My muscle, I haven't necessarily gotten more of it, but it's more dense, like it's more defined. Um, so that's good. Uh, like I said, nothing. I don't really think my voice has changed or anything like that. Nothing really monumental has happened in the first month. So I guess I was like, I don't really need to make an update until I have a beard, but that would be like a year, you know. But I am now, however, falling into the category of looking like a 12-year-old boy, which is extremely frustrating. You know, I can't even go to the movies without getting carded now, and it's extremely frustrating because it's really disrespectful. Um, and it's just like, oh well, it's just. I know people are like, you're gonna love it when you're older, but I'm just like, I really don't think I'm. No, I mean, I have a young face, and I'm glad I don't look like I'm 40. But at the same time, I'm like, when I am 40, I want to look, a little older than 12. So, but I guess I have a ways to go before I'm 40, obviously. Anyways, so let's see here. I do have a small family update. I told my uncle, and he was actually pretty supportive. He's really the only kind of extended family member that I've told, which is I was a little nervous because I'm not close to a lot of my extended family, but he's just a cool guy, and he's been going through some tough times too, and I don't know. I wanted to keep that relationship going, and I feel like if I'm gonna make an effort, then I should be completely honest. Um, my mom is still being weird about it. She's leaving me notes now, which is odd. Like, I'll be gone. I'll come home from work, and there'll be a note like, I'm disappointed in you. I'm like, okay. But she feel like, I'm just like, why couldn't you just say to my face? It's just getting kind of annoying. Like, they'll be like, I love you, but you suck in this decision. I'm like, okay. What? It's really confusing. I don't, I'm sure it's pretty dark in here, sorry. It's dark outside, and I didn't really feel like turning, I don't know. My eyes have been really sensitive lately to light, so, um, oh, I did want to briefly touch healthcare. Um, so I'm sure a lot of people are like, hooray, healthcare. I do think it's good for some people, and I think it's bad for others. I'm not I'm not going to say what side I'm on. I think it's good for me because, well, it's good and bad for me because obviously this is like a really expensive process, transitioning, but at the same time, I don't, I have to go to a specialist. And the thing is I don't, if I don't have health insurance now, and because they're going to pretty much force me to be on a certain insurance based on my income, which I really don't like, and then because there'll be no, from the way I understand how insurance works, you have to pretty much use the doctors that are given to you by the insurance company. Now, I'm pretty sure that most insurance companies don't, a lot of doctors are probably actually going to leave, in all honesty, probably leave the healthcare system because they're not going to be able to make the big bucks anymore, and there's not going to be any private sort of things, which is good and bad. It's good because all of a sudden you can't be charged out of the ass for a basic procedure going to the endo, but at the same time, finding an endo in the first place that has transgender experience is difficult anyways. So now it's going to be more difficult because now you have to find one that's also covered by your insurance, you know, because it's kind of like that. So I'm a little weary of being forced to go to a doctor that knows nothing about me. But at the same time, on the pro side, you know, I wear contacts. I have horrible vision, and I haven't been to the optometrist in probably 2 years because I've been wearing these contacts for a long time because I haven't really had the money to go. You know, I don't have the, you know, $100-something to go and get new contacts and do all that stuff. And it would be nice to be, you know, covered by an insurance plan that goes. So, like I said, there are pros and there are cons, and I don't think it's good or bad one way or the other. But I do think that as a community, we need to be aware of the situation, that, you know, our transition is going to be deeply affected by this. And, you know, it might make it harder for us. And, I mean, it already is harder, so, yeah. But, I just wanted to go ahead and say that. So, I don't know where that puts me, I guess. But I'm a little nervous, I guess, about the future of just, you know, gender identity and how it's going to take place, because all of a sudden, if we're all just little letters to the government, and they don't, you know, the government isn't exactly known for getting personal and up close, you know what I'm saying? It's just, yeah, I'm cautious about it. I'm cautious. So, if you guys have opinions on it, I would love to hear them, because I think it's a very important topic that we all need to discuss in a realistic setting, you know, what's going to happen, you know. So, anyways, next month, hopefully, I'll have a deeper voice, and I'll be up to my full dose in a couple of weeks, so, because so far the doctor said everything looks fine, so, anyways, just letting you guys know I'm alive. Nothing much has happened, and I will catch you guys later. Peace out.